Today we are going to discuss very important topic that is related with the canines, the pet owners. It is shedding of virus during and after the clinical infections. So when the canines, dogs, pets, they suffer from viral disease, it is a very common practice that the virus is excreted from their body from various secretions and excretions. And sometimes these viruses are shed even before the clinical symptoms appear. So in this way, it becomes very important to have a constant watch and monitor our animal who might have been infected by the virus. Shedding can be seen in the urine of the animal, saliva of the animal, milk of the animal, feces of the animal, and even in the genital discharge, nasal discharge, ocular discharge of the animal. And these viruses which are shed by the infected animal during the infection, before the infection, and before the appearance of the clinical symptoms, and even after the recovery of the animal. Animal has recovered, looks proper, normal, taking feed and water, everything. Even then the shedding of virus continues for many days. So we have to discuss, we have to be careful that during such situation what should be done. Because these viruses which have been shed by infected animals, they pose a big threat to the nearby animals, surrounding animals which might or might not have been vaccinated. So there are many diseases, we are not going to, it's a huge list of the diseases, but the diseases of dogs, particularly the viral diseases, which are more common in India. We all have pets at home. Sometimes we have the knowledge regarding the viral diseases, sometimes we are unable to detect. One very important disease is canine parvovirus. Almost every alternate animal of the India has faced this canine parvovirus infections. It is a disease of young pups between 6 months to 1 year, or even sometimes even younger, 3 to 6 month old pups. So during this infection, the animals, they suffer from diarrhea, severe enteritis, severe dysentery, and the virus is mainly excreted in animals in their fecal material. A very heavy concentration of viruses are shed by these animals, and these viruses which have been shed in the fecal material, they pose a severe and threat to the other susceptible animal nearby. These dogs, sometimes they transmit the virus to other susceptible animal, and it becomes difficult for us to diagnose. So we have to watch our pet. If there is diarrhea, any kind of diarrhea, might not be due to the parvovirus, there are so many causes of viral diarrhea. So we have to get it diagnosed properly so that other susceptible animals should be protected. And the shedding of virus continues in the fecal material, in the feces, for about 14 days, even after the recovery of the animal. Animal has recovered, but still it continues to shed the virus in their fecal material. The second such disease in the canines is a canine distemper virus. This kind of virus, this is generally shed during coughing, sneezing and barking of the animal. It mostly affects the upper respiratory tract and intestinal tract. The virus is also excreted in the saliva, in the urine and in the feces of the infected animal. These viruses which are shed in these specimens, saliva, urine and feces, they infect the other healthy susceptible animals nearby. The shedding of the virus continues sometimes for 2 weeks or even more longer. It goes up to the 3 months. Even after the recovery of the animal, the virus shedding is continuous in their saliva, in their urine, in their feces, during their coughing, respiratory exudates and respiratory secretion. Third such disease is canine influenza. Canine influenza is transmitted direct from dog to dog by direct contact, particularly by the inhalation of the droplets which are exhaled during the coughing. And this virus, canine influenza virus, is also transmitted through the indirect method by the bedding material, by the people attendant who are attending these animals, and they through their cloths, shoes and other utensils. The virus can be generally shed in their oral secretions, nasal secretion, ocular secretion and fecal material. So we have to be careful. We have to have a regular watch on our animal when the animal is showing some abnormal symptoms, and we have to watch the secretions and excretion of these animals. Since canine influenza is having so many different types of the virus, all the types of the virus, they have their own duration of shedding. For example, the type H3N2, this type of canine influenza virus, it is generally shed up to 21 days, 3 weeks. And other type of the canine influenza virus, particularly H3N8, it is generally secreted from 7 to 10 days. So we have to have a constant watch up to this period so that our other susceptible animals can be protected. The next infectious disease, we are basically focusing on viral diseases. There are so many other diseases. We are not going to discuss those diseases today in this lecture. This is infectious canine hepatitis. So this infectious canine hepatitis virus, the infected animal, it secretes the virus, shed the virus in their urine, in their feces and in their saliva. And if the healthy animal comes in contact of any one of these secretions, urine or feces or saliva, the susceptible animal may pick the infection. The shedding of virus from the infected animal continues up to more than 2 weeks, even after the recovery. Animal has properly recovered, animal is taking the feed and water properly, but the shedding of virus continues in their feces, in their saliva, in their urine. So we have to protect our other susceptible animal not to come in contact of these excretions, even the animal has recovered. The vaccinated animals, they also shed the virus, but this virus is attenuated virus. It is not going to produce the disease in susceptible animal. And in one way, if the infected animal is vaccinated, it is shedding the vaccine virus. And when other susceptible animals comes in contact of this vaccine virus, indirectly they get the vaccinated. So this is a good practice to protect our other susceptible animals against infectious canine hepatitis. The next viral disease is canine alpha herpes virus 1. In this case, there is a long-term shedding of the virus, particularly from their nasal and ocular secretion, mostly from 11 to 36 days. Almost 5 weeks the virus is excreted from their secretions, ocular and nasal secretion. The disease should be diagnosed as early as possible so that we can protect our other susceptible animals. The animal pups particularly, which are showing ocular symptoms, ocular lesions, they have a very high concentration of virus in their nasal secretions. The next and the most important disease is rabies. Almost so many people in India, they die every year of the rabies because of the dog bite. So dogs which are infected by rabies virus, they shed the virus in their saliva as well as in other body secretions. And rabies virus remain alive for many days inside the body, particularly in the brain tissue, for many days, for even months, for even years even. So if the tissue from dead animals, dead infected animal is frozen, virus remain live for many years. But outside the environment, the virus is very fragile, and under temperature 45 degree, virus gets inactivated within 2 to 3 hours. So overall, we have seen that there are many diseases which we have listed: canine parvovirus, infectious canine hepatitis, canine influenza, canine alpha herpes virus 1, rabies, canine distemper. All these viruses have been reported from every part of India, from the pets as well as from the stray animals. So we have to protect our pets against these diseases, particularly via vaccination. And after vaccination, we have to monitor our animals so that they should not get contacted the virus from other stray animals. So this is the nutshell of my today's lecture, that the virus which are shed in the various secretions and excretions of the animal during and after recovery, they have to be monitored and diagnosed properly. Thank you. Thank you very much.